It's incredible how much buzz the ketogenic diet is generating these days, far beyond just weight loss.
Mm.
People are looking at it for, well, all sorts of health issues.
Absolutely. It seems to be everywhere.
And you reached out, sharing some fascinating research and wanting us to really dig into what the science says about keto, specifically when it comes to Parkinson's disease.
That's right. We've gathered a really interesting set of sources to explore today, aiming to, extract the most crucial information for our listeners.
Sounds great.
Our main focus will be a recent study investigating the effects of keto on Parkinson's, but we're also going to look at the bigger picture concerning heart health
Okay.
and some important potential risks for certain individuals. We need that balance.
Exactly. So our central point for Parkinson's is this 2024 study by Tidman and colleagues. It followed individuals over time to see how a low-carb, high-fat diet impacted their Parkinson's symptoms.
Right. And then to give us that broader understanding you mentioned, we have a 2024 review by VLEKT examining the link between the ketogenic diet and cardiovascular risk. Mm-hmm.
And because it's vital to see all sides, we'll also be looking at a con perspective from Joshi and team, also from 2024.
Ah, okay, the counterpoint.
Precisely. Which outlines potential risks of keto for individuals with chronic kidney disease.
Crucial context.
And finally, we even have a really interesting case study now. It doesn't focus on Parkinson's directly, but it looks at how ketogenic metabolic therapy affected psychiatric symptoms and metabolic health.
And that touches on some of the non-motor aspects that are so significant in Parkinson's, right? Like mood and cognition.
Exactly. So it's relevant. It's a great collection of material, giving us both a focused lens and that wider perspective.
So how should we structure this?
Well, I think we should start by dissecting that Parkinson's study. The way they conducted it, what they found regarding both movement and non-movement symptoms.
Okay.
And the changes they observed in health markers and overall quality of life. There were definitely some surprising elements there.
Good point. Following that, we'll broaden our view to the cardiovascular implications, drawing on that review article to discuss weight, blood lipids, glucose metabolism.
Right, the heart health angle.
Making sure to address any conflicting evidence or ongoing debates, because it's not always clear-cut.
True.
After that, we need to carefully consider the potential risks, particularly for those with chronic kidney disease, based on that con perspective.
The Joshi paper, yeah.
And lastly, we'll integrate the insights from that case study, especially concerning mental well-being and the fact that while people can respond very differently to ketogenic approaches.
And maybe touch on sticking to the diet, practical stuff.
Definitely. Practical aspects of adherence and the support that might be needed.
All right, let's dive in. Starting with this Parkinson's study. As the study itself notes, Parkinson's disease is the second most common neurodegenerative condition.
Yeah, it's progressive, sadly.
And while we often think of the more visible motor symptoms like tremors, stiffness, gait issues,
The classic signs.
it also involves a wide range of non-motor symptoms. Anxiety, depression, cognitive difficulties. These can really impact a person's daily life.
Massively. And fundamentally, it involves the loss of nerve cells in a specific area of the brain, leading to that reduction in dopamine levels.
So what's particularly interesting is why researchers are even exploring ketogenic diets for Parkinson's. What's the thinking there?
Well, the study points out that ketones, and specifically beta-hydroxybutyrate, have demonstrated neuroprotective and anti-inflammatory effects,
Okay.
particularly in the context of epilepsy, where keto diets have been used for a long time.
Right, it's well established.
They also highlight the connection between the Mediterranean diet, which is rich in healthy fats, and observed neuroprotective benefits in Parkinson's.
Ah, so the high-fat connection.
Exactly. So the thought is that a ketogenic diet, being very high in fats and leading to the production of ketones, might offer similar or maybe even more pronounced advantages.
Makes sense. So this Tidman study was a 24-week pilot. And you're right, it involved a small group, just 7 individuals with Parkinson's.
Yeah, small sample size, definitely a limitation to keep in mind.
But across different stages of severity. What struck me was that it was a longitudinal study, meaning they tracked these participants over time.
Which is good, gives you a sense of change.
And they used a mixed methods approach, gathering both quantitative data, numbers and measurements,
Right.
and those really insightful qualitative accounts of their personal experiences.
Exactly. That combination is powerful. The dietary intervention itself was quite specific. Roughly 70 to 75% of their daily calories from fat.
Wow, that's high.
It is. Then 15 to 20% from protein and only 5 to 10% from carbohydrates, totaling around 1,750 calories per day.
So very low carb, high fat.
Very. And they collected a wide array of data from standard Parkinson's assessments, like the UPDRS, which looks at both motor and non-motor symptoms, to questionnaires measuring depression and anxiety, and a whole set of health biomarkers, things like BMI, blood sugar control, HbA1c, insulin levels, cholesterol, inflammation markers like hsCRP.
Comprehensive.
Very. They even monitor blood glucose and ketone levels weekly, along with changes in weight and waist circumference, and conducted interviews to understand the impact on quality of life.
Okay, so what did all those numbers actually reveal? What were the key findings?
Well, some of the most notable quantitative findings were significant improvements in several metabolic markers. They saw statistically significant decreases in triglycerides.
That's good.
Fasting insulin levels were very close to being statistically significant. HbA1c improved significantly, and they saw reductions in both weight and waist circumference.
So definite positive shifts in metabolic health.
Yeah, quite clearly.
And what about the direct impact on Parkinson's symptoms and those mood-related scores? That's the big question.
Right. Interestingly, they found statistically significant improvements in the UPDRS Part I scores,
And that covers.
mentation, behavior, and mood. This is particularly significant because these non-motor symptoms often have a profound impact on daily life.
Sometimes more than the motor ones, yeah.
Exactly. The fact that the keto diet showed improvement here suggests a potential impact on brain function beyond just motor control.
Okay, that's really interesting. What else?
They also saw significant improvements in both depression scores using the CESDR-20 scale and anxiety scores on the Parkinson's anxiety scale.
Wow. So mood improvements too.
Yes. However, there wasn't a significant change in UPDRS Part 2 scores, which relate more to activities of daily living.
Okay, so mixed on the UPDRS parts.
A bit. And importantly, the participants were able to maintain those target ketone levels in their blood between 0.5 and 2.0 millimole usually.
Which means they were actually sticking to the diet.
It indicates good compliance, yes.
That's really striking. Improvements in mood and behavior are so vital for overall well-being in Parkinson's. But the qualitative findings, those personal stories, they must add another layer, right?
Absolutely. When the researchers spoke with the participants about their quality of life, they consistently reported positive changes across different areas.
Like what specifically?
Physically, beyond the improved biomarkers and weight loss, they mentioned things like reduced body pain,
Oh, interesting.
and even feeling stronger and more physically active. Some family members even noticed improvements in their loved one's speech and facial expressions.
Wow, that's quite something. And socially, Parkinson's can sometimes lead to people withdrawing.
Exactly. Participants talked about feeling more relaxed about everyday frustrations and regaining confidence, particularly related to body image changes from weight loss,
Mm-hmm.
which in turn made them feel more comfortable going out and engaging with others. Rejoining the world, as one put it.
That's huge.
And they found ways to adapt the keto diet to their lives, like learning to use specific oils like coconut or avocado oil. And surprisingly, some even found it easier to manage their diet when eating out, with a few adjustments.
So it wasn't impossible to manage socially.
Apparently not for these participants.
And what about mentally? That feeling of brain fog is something we hear about quite a bit in neurodegenerative conditions.
Yes, several participants reported a noticeable reduction in that brain fog. They felt their thinking was clearer.
Better cognition.
Improved cognition. Yeah, things like vocabulary recall, thought processes. Some specifically link this to consistent intake of healthy fats like coconut oil.
Interesting anecdotal link there.
They also reported sleeping better, a lessening of their depression, and while anxiety was still a challenge for some, it had generally improved.
So overall, a more positive mental state.
Definitely. A significant positive shift in their emotional outlook and general attitude. And they even experienced a decrease in their cravings for sugary foods.
That's another common benefit people report with keto. It sounds incredibly promising. Did the study look at what helped them stick with it, the barriers and enablers?
It did. Strong support from family members was consistently identified as a crucial factor.
Makes sense. It's a big change.
Absolutely. Additionally, having a more optimistic overall perspective on life seemed to strengthen their motivation to continue. And significantly, the participants generally expressed their intention to maintain the diet long term.
So what's the bottom line from this specific study on Parkinson's, the main takeaway?
The researchers concluded that this low-carb, high-fat approach appears to be safe, feasible, and importantly, has the potential to alleviate Parkinson's symptoms, both motor and non-motor.
Potential being the key word there.
Exactly. They propose mechanisms like ketones acting as an alternative fuel for the brain, potentially slowing neurodegeneration through anti-inflammatory effects,
Yeah.
and maybe impacting neurotransmitter levels. However, they rightly stress that much larger, well-designed, randomized controlled trials are definitely needed.
Can't base widespread recommendations on 7 people.
Absolutely not. We need more robust evidence to confirm these initial findings and develop broader clinical recommendations.
Okay, that gives us a really interesting, hopeful look at keto in Parkinson's specifically. But now we need to broaden our perspective, step back, and consider cardiovascular health.
Right, the bigger picture. That's where the VLEKT review comes in.
Because keto is often discussed for weight loss, and heart health is always a concern with dietary changes, especially high-fat ones. What does the broader literature say?
This review provides a good overview. Regarding weight loss, several meta-analyses comparing keto to more balanced diets in people with obesity have shown. Well, the results are a bit mixed.
Also,
While long-term differences in overall BMI might not always be significant, keto can lead to notable weight loss, especially depending on how long the strict ketogenic phase lasts.
okay.
It also tends to result in a reduction of both fat mass and lean body mass.
Losing muscle mass isn't always ideal, though.
It's something to be aware of, yes. And what about in individuals with diabetes who often have a higher cardiovascular risk?
Good question. What did the review find there?
Some meta-analyses focusing on diabetic patients have shown that keto diets can lead to greater reductions in body mass and waist circumference compared to moderate carb or low-calorie diets.
So some advantage there.
Potentially. Although, again, significant differences in BMI weren't always observed in some studies.
Okay.
And it's important to note, many of these studies didn't directly compare keto to the Mediterranean diet, which is a well-established recommendation for this group.
Right. That's a key comparison that's often missing.
One interesting finding was that while keto seemed to cause more weight loss than standard diabetes-recommended diets in the short term, say 3 to 6 months, this advantage wasn't always sustained at the 12-month mark.
So the long-term benefit might diminish. That highlights the need for longer studies.
Absolutely. Now, a major concern with any diet, especially one so high in fat, is its impact on blood lipid levels, cholesterol, triglycerides.
Yeah, that's always the worry with high-fat diets, isn't it? What did the review uncover?
The findings on blood lipids are actually quite varied. It really seems to depend on the specific group being studied.
Okay, break it down for us.
In individuals of normal weight, ketogenic diets have been shown to significantly increase total cholesterol, LDL cholesterol, the bad kind,
I could.
APO, which is linked to LDL, and HDL cholesterol, the good kind, so a mixed bag even there.
Right.
An umbrella review also suggested keto might increase LDL and total cholesterol in overweight or obese individuals without diabetes.
Okay, so a pattern potentially emerging there for LDL increase.
But other meta-analyses in obese individuals found no significant differences in total cholesterol, LDL, HDL, and triglycerides when comparing keto to balanced diets.
Conflicting results then.
Very, and one meta-analysis even reported decreases in total cholesterol and triglycerides with keto in obese individuals. So it's really not straightforward.
That's quite a spectrum.
No.
What about in people with diabetes? How do their lipids react?
In diabetic patients, when keto diets were compared to diets with moderate amounts of carbs, say 40–60%, there were no significant differences seen in total cholesterol, HDL, and LDL levels at 3, 6, and 12 months.
Interesting. What about triglycerides?
Triglyceride levels did decrease with keto at the 3-month point, but this effect didn't seem to persist longer term in those comparisons. However, when ketogenic diets were directly compared to diets specifically recommended for diabetes management.
Right, like standard ADA guidelines, perhaps.
Exactly. Keto did show greater reductions in triglycerides and increases in HDL levels at those same 3, 6, and 12-month time points.
So compared to those specific diets, keto looked better for triglycerides and HDL in diabetics.
Correct. It shows how the comparison group really matters. So the impact on lipids is complex, not universally beneficial, depends on who you're studying and what you're comparing it to.
Definitely sounds like it needs careful individual monitoring. The review also addressed glucose metabolism, right? Blood sugar control.
Yes. In shorter-term studies, like 4 to 24 weeks, involving overweight or obese individuals, combining a keto diet with exercise didn't seem to significantly alter fasting glucose levels compared to a control group.
Okay.
This was also seen in diabetic patients. No significant differences found in glucose levels, fasting insulin, or insulin resistance between keto and other diets in some analyses.
That's a bit surprising given the extreme carb restriction.
It is. Although, interestingly, a dose-response meta-analysis suggested that for every 10% reduction in carb intake, there was a corresponding reduction in fasting glucose in diabetics,
Oh, okay.
but only in the short term, up to 6 months. This effect wasn't maintained at 12 months or longer.
Again, that theme of short-term versus long-term effects.
Exactly. And one of the final but really crucial points the review makes concerns the long-term sustainability and the overall nutritional quality of the ketogenic diet.
Right, because you're cutting out entire food groups.
Precisely. The review emphasizes that the long-term health benefits of any diet are largely determined by nutrient quality things like low saturated fat, high fiber, plenty of fruits and vegetables.
Which keto often struggles with.
Yes, with its inherent strict restriction of whole grains, fruits, and many vegetables, it often doesn't meet these standard recommendations. The European Society of Cardiology even advises professional supervision for keto diets.
So proceed with caution, basically.
Yes. They acknowledge potential short-term benefits like triglyceride reduction and blood sugar control, but stress the need for careful management and highlight concerns about LDL increases and overall diet quality. The key takeaway is that while keto might offer some initial metabolic advantages, its long-term cardiovascular implications need very careful consideration.
That's a really important perspective, balancing the potential benefits we saw in the Parkinson study with these broader cardiovascular questions. Now, we need to shift focus again to the potential downsides, especially for a specific group, individuals with chronic kidney disease, or CKD.
Yes, this is where the Khan perspective from Joshi and colleagues comes in. It really brings these concerns to the forefront.
What are the main worries?
Well, this article specifically addresses the risks for people with CKD. They acknowledge there isn't a huge amount of direct research on keto in CKD populations.
Okay.
But they draw logical inferences from existing data. One primary concern is the impact on kidney function itself.
Does keto harm the kidneys?
Some shorter studies, 3 to 12 months, haven't shown negative effects on measures like GFR, but the authors point out significant limitations. Short follow-up, high dropout rates, maybe poor adherence.
But we can't be sure about long-term safety.
Exactly. It makes it difficult to draw firm conclusions for this vulnerable population. More research is definitely needed there.
Are there other specific kidney-related issues they raise?
Yes, they express concern about albuminuria protein in the urine, a marker of kidney damage. This has been linked to higher intakes of saturated and animal fats.
Which are often high in keto diets.
Typically, yes. They also highlight the limited intake of fiber-rich plant foods in keto and the potential loss of the benefits these foods offer CKD patients, like helping with gut health and inflammation.
Right. But one of the most significant concerns they raise is metabolic acidosis. Can you explain why this is such a big deal for people with kidney disease?
Okay, so metabolic acidosis is when the body's fluids become too acidic. This can happen if the body produces too much acid, or more relevant here, if the kidneys aren't removing enough acid.
And kidneys in CKD are already struggling.
Precisely. The authors explain that ketogenic diets, with their increased dietary acid load, mainly from animal protein, and potentially reduced bicarbonate production due to ketogenesis itself, can worsen this condition in people whose kidneys are already compromised.
And what are the consequences of uncontrolled metabolic acidosis in CKD?
They can be serious. Worsening of renal bone disease, muscle wasting, low albumin levels, inflammation, protein malnutrition, and even an increased risk of death.
Wow. Okay, that sounds like a really significant potential complication, a major red flag.
It absolutely is. It's
Yeah.
disrupting that delicate acid-base balance that the kidneys are supposed to maintain.
Are there any other specific kidney-related risks mentioned?
Yes, they also point to nephrolithiasis, which is kidney stone formation.
Kidney stones.
Yeah.
Why might keto increase that risk?
It might be due to increased excretion of uric acid in the urine and potentially lower levels of citrate. Citrate normally helps prevent stone formation.
Okay, another potential problem. So the overall message from this perspective is definitely one of caution for anyone with CKD considering keto.
Absolutely. While the authors acknowledge keto can cause weight loss and improve blood sugar control benefits that might seem appealing,
Right.
they emphasize that sticking to the diet long-term is tough, and any initial benefits might become negligible compared to higher carb diets after about a year, as we saw in some other studies. Given potential side effects like kidney stones, metabolic acidosis, maybe unfavorable lipid changes, and the fact that there are other dietary options,
Like plant-based diets. which are often recommended in CKD.
Exactly. They strongly recommend that doctors carefully weigh the risks and benefits individually with their CKD patients. They even suggest keto might worsen CKD complications and prevent patients from getting the known benefits of plant-focused eating.
So it's not a go-to recommendation for this group.
Definitely not. They suggest maybe reserving it for those who've tried other diets without success, and they do float the idea that a plant-based ketogenic diet might mitigate some risks.
But that needs more research, too.
Absolutely. So for our listeners, especially if kidney health is a concern, this really highlights the critical importance of discussing any major dietary changes with your doctor first. It's not one size fits all.
That's a really crucial counterpoint, essential context.
Yeah.
Now, to bring another layer to our understanding, let's turn to that case study you mentioned earlier. It wasn't Parkinson's, but it looked at ketogenic metabolic therapy, KMT.
Right. And it provided some fascinating insights, particularly regarding mental health aspects, which, as we've discussed, are often intertwined with conditions like Parkinson's.
So what was the situation in this case study?
Well, it involved a man with a complex history: bipolar disorder, depression, anxiety, ADHD, plus hyperlipidemia and hypertension. So multiple psychiatric and metabolic issues.
Okay. And he adopted KMT.
Yes, ketogenic metabolic therapy. And the reported outcomes were, frankly, quite remarkable.
What kind of positive changes did they see?
He reported experiencing increased mental focus, much greater energy levels, improved confidence, and a significant boost in motivation that actually allowed him to return to work.
Wow.
Within just a few weeks of starting, he apparently secured a demanding job and even started college courses.
That's a rapid turnaround.
It sounds like it. By the 10-week mark, his obsessive thoughts had decreased considerably, his anxiety was reported as being almost gone, and he noted improvements in his relationships too.
And was he actually in ketosis?
Yes, importantly, he was able to consistently achieve therapeutic ketosis, showing he was adhering to the diet and it was having the intended metabolic effect.
That's really significant. Were there any challenges or adjustments needed? It can't always be smooth sailing.
No, and they highlighted that too. Initially, he found it difficult to meet his daily fat intake goals, which isn't uncommon.
Right.
And he experienced fatigue during exercise. Lab work revealed low levels of carnitine, which is important for using fat for energy.
Oh, so a specific deficiency was identified.
Exactly. By increasing red meat intake and supplementing with acetylcarnitine, the fatigue resolved, and he actually achieved more consistent ketosis.
That really underscores the need for personalized monitoring and potential supplementation, doesn't it?
Absolutely. It's not just about cutting carbs. The details matter.
And it's interesting that the case study didn't mention some of the common side effects we often hear about with keto, like the keto flu, nausea, insomnia.
Right. In this specific case and others mentioned in the report, those weren't prominent issues. And the researchers didn't identify any significant negative interactions between the KMT and his existing medications.
Good to know.
Though they did note none of the patients in their report were on certain anticonvulsants that might increase kidney stone risk, which ties back to our previous discussion.
Ah, okay. The study also briefly touched on the broader research landscape for keto and diagnosed mental health disorders, right?
Yeah.
Not just symptoms.
Yes, they mention a recent meta-analysis looking at low-carb diets for depression and anxiety symptoms across various conditions. The findings were apparently somewhat inconclusive.
Why was that?
The authors of this case study suggested it might be because that meta-analysis lumped together a wide variety of diets, some with much higher carb or protein levels than typical keto.
So not truly ketogenic sometimes.
Potentially. And they didn't consistently report ketone levels or use standardized outcome measures, so it muddies the waters.
Right. Makes it hard to draw conclusions about strict keto.
Exactly. It emphasizes the need for more focused research specifically on well-defined ketogenic metabolic therapies for specific psychiatric conditions.
And the case study also underscored the practical side, actually doing KMT and sticking with it.
Absolutely. They highlighted that we currently lack extensive research on how best to identify who might benefit most from KMT for psychiatric issues and what factors really help with successful long-term adoption.
Things like support systems.
Yes. They included some quotes from other case reports mentioning improvements in mood, irritability, sleep, energy, but also stressing the critical role of accountability and support, whether from a healthcare team or a community. That seems key.
Okay, so we've covered a lot of ground here, from Parkinson's specifics to broader heart health, kidney risks, and these individual case insights. As we bring everything together, what are the main takeaways from our deep dive today?
I think the first point is that the ketogenic diet showed some genuinely promising, though preliminary, results in that small Parkinson's pilot study.
Yeah, improvements in non-motor symptoms like mood, anxiety, plus metabolic markers.
Right, but, and it's a big but, the broader cardiovascular effects are complex. They can vary a lot between people, and that potential increase in LDL cholesterol is definitely a concern for some.
Okay, complexity and caution there.
Then, for individuals with chronic kidney disease, the con perspective raises significant red flags: metabolic acidosis, kidney stones. The risks seem substantial.
So definitely not for everyone and needs extreme caution in CKD.
Precisely. And finally, that case study reminds us that individual responses can be highly variable. Success might depend on careful nutritional support, addressing deficiencies like carnitine, and having good adherence strategies.
And it's so important to keep hammering home that the Parkinson's study, while encouraging, was small. We absolutely need larger, well-controlled trials before making any broad recommendations.
Couldn't agree more. The research on cardiovascular health and kidney disease really just reinforces the vital importance of personalization. You have to consider each person's unique health profile.
Weighing those potential risks and benefits carefully, and always in consultation with healthcare professionals.
Absolutely. Which brings us to a final thought, maybe, for our listener to consider.
Alon?
Given these diverse findings, sometimes conflicting, how should individuals really approach dietary changes, especially when dealing with something complex like a neurodegenerative condition or other significant health concerns?
Yeah, it's not simple.
And what crucial role should personalized nutrition strategies and guidance from qualified healthcare professionals play in making these decisions? It's not something to jump into lightly based on headlines.
That's a perfect point to end on. We really encourage everyone listening to explore the research further, but most importantly, have those open, thorough discussions with your own doctors. They can help determine the most appropriate and safest strategies for your specific